Welcome to the short introduction to the interjurisdictional TB notification transfer and follow-up forms. These forms are also known as the IJN forms. And these forms were revised in 2015 and should replace the previous versions of the IJN forms. It may be helpful to have the electronic version of the forms available as we move through this presentation. And the forms can be found on the National TB Controller's website at this address here on your screen. And I'm going to go ahead and open up the electronic version of the forms so that you can see what those look like. All right, so starting with the IJN transfer form, I'm going to go section by section, demonstrating the use of the form and highlighting some important points. Now, this first page of the form, it collects basic information on the referring jurisdiction, where the IJN form is being sent to, and the referred person's information. And the second page of the transfer form collects pertinent information about the referred person's TB status. And then the third page of this form collects information pertinent to the treatment of the patient that's being referred. I'll go back up to the top of the form here. Because it's critical to the receiving jurisdiction to know the type of referral and the date the person is expected to arrive, these fields were put at the very top of the form. So you'll see here that there's 4 options for type of referral: active suspect TB, TB contact, class AB, and TB infection. And depending on what you choose, the form prompts you to fill out the appropriate section. You'll also put the date of expected arrival here. This is a link to an online directory of the state and big city TB programs. So if you are needing to look up where this form is going to be sent to, you can click on that link and it will give you the appropriate interjurisdictional transfer contact. The next section of the transfer form here captures the referring jurisdiction's information and the receiving jurisdiction's information, right here, form sent to, and also gives you instructions on any follow-up that needs to be done. So it's important that the referring jurisdiction fill out its contact information completely. And the referring jurisdiction should also identify whom the transfer form is being sent to and when it was sent. The form also asks the referring jurisdiction to indicate whether the form was sent to the state, county, or other location. And typically the transfer form is sent to the state, and the state forwards that information on to the county or local health department. The location drop box here aims to identify forms that were not sent to the state so that they can be forwarded appropriately, and it allows the state to see if the form has already been sent to a county or local health department so that duplicate notification can be avoided. The Return Follow-up Form 2 subsection allows the referring jurisdiction to provide instructions for the receiving jurisdiction regarding preferred follow-up notification. The follow-up requested drop-down box allows the referring jurisdiction to request follow-up within 7 days of the referred person's arrival, 30 days, or maybe they don't want to receive any follow-up notification until a final diagnosis has been made or the person has finished treatment. There's also an other option here. So if you were to click other, then you can fill out this text field here with additional instructions. And the next section here is the referred person's information. It collects basic demographic information, and it's collected in the same format used on the Report of Verified Case of Tuberculosis, or RVCT form. For example, the options in the drop-down boxes for race and ethnicity are the same options used to complete the RVCT form. And you'll notice here there's a primary language field and an interpreter needed drop box. If you select yes that an interpreter is needed, it's going to be assumed that the interpreter will need to be in the patient's primary language. And then this new address field, this is a very important field because it's imperative that the referring jurisdiction enter as much locating information as possible so that the receiving jurisdiction can locate the patient. In addition to the basic address, phone number, and email address information, there's also a place to record the name and contact information of an alternate contact, such as a spouse or roommate. So now we're moving on to the second page of the transfer form. And these sections collect information pertaining to the referred person's current TB status. So keep in mind, this transfer form is not meant to be a duplicate of the RVCT or medical record, but it's a quick overview of the patient's status. The RVCT form and medical information such as lab or imaging results should be sent as an attachment along with this form. Throughout the following 4 sections, you'll notice blue information icons here, the blue circle with the eye in the center. If you click on these icons, they will take you to online resources that may be helpful in filling out the form. I'll click on this one so you can see. Right here. So this particular one just takes you to the MMWR, where it talks about active and suspect cases of TB. And these information icons are available in each section. So now talking specifically about section 1. So this applies to active or suspect TB disease, and the referring jurisdiction should document the RVCT number here if applicable. The site of disease drop down here gives you the options of selecting pulmonary, extrapulmonary, or both. Again, remember on an RVCT form, it's going to give the specific site of disease, and this is just a general overview for the receiving jurisdiction so they know whether it's pulmonary or extrapulmonary TB. There's also a drop down here for treatment status. So if treatment has been started, then it will prompt you to fill out section 5, which is the treatment section we'll get to in a little bit, or you can indicate if the patient needs to be placed on treatment. The form also includes drop-down fields for recording the most recent respiratory smear, and it's important that the receiving jurisdiction knows if the referred person is a transmission risk at the time of arrival. So that's why the form asks for the most recent respiratory smear and culture. Additional diagnostic information should be sent as an attachment along with the transfer form. And so you can indicate what attachments the receiving jurisdiction should refer to. So this is where, like, if you have some old smears and old cultures that you want to attach, you would just indicate that you're attaching them to the form so that the receiving jurisdiction knows to look for that history. Now, the drug sensitivity mutation analysis got its own drop-down because it's important for the receiving jurisdiction to be able to quickly identify whether or not the person has any sort of drug resistance. And so that's why there's a drop-down here. And there's also a drop-down for genotyping results. And this is because a lot of times genotyping results are electronic. And so printing them off or attaching them to this notification form may be difficult. So you have a drop-down here and then an area where you can record the genotype. So Section 2 is a place to record information about a contact that's being referred. So you'll want to make sure that you document the date of last exposure, and this is important information so that the receiving jurisdiction knows that the patient will need 2 TB tests or just 1 as part of their contact follow-up. And then you'll notice a contact priority box here. I'll show you that we have options of high, medium, close, and low other than close. These priorities are in line with CDC recommendations. So if you click on that blue icon, it will take you to a CDC webpage that talks about the difference between high priority contacts, low priority contacts, etc. And keep in mind that there are some jurisdictions that don't have the resources to test medium and low contacts. So if you transfer a contact to one of those jurisdictions, you may get some follow-up back saying that they weren't actually tested because we didn't have the resources. And this drop down here is for the initial TB test. It allows you to identify what type of TB test the person had or whether they need TB testing. There's also an option to click NA. And this would be the appropriate option to choose. For instance, if you had a contact who had been exposed to TB, say 3 months ago, so they are not going to have 2 TB tests. They're just going to have a single 8 to 12 week post-exposure test. So you would click NA for the initial TB test, and then you would enter in the information in the 8 to 12 week post-exposure box, whether that's that they already had that 8 to 12 week post-exposure test or they are in need of that test. And then, of course, you'll write the date of the test. You'll attach the actual results, but you can indicate whether they're negative, positive, indeterminate, borderline. And if it's a TST, there's a space to document the millimeters here. Same with radiology. You can say that you've attached the results, that it's not done, that the results are pending, or if the patient needs an X-ray. On the contacts treatment status drop down, you can state that the treatment has started or that they need treatment. And then there's also an option here for you to choose window prophylaxis has been started or that they need window prophy. So Section 3 is specific to Class A or B immigrants and refugees. And not infrequently, refugees or immigrants arrive in the U.S. and move to a different jurisdiction before their TB evaluation is complete. And if that occurs, then information is collected in this section. And the referring jurisdiction should record the TB classification. And again, if you don't know what those TB classifications are, you can click on this icon here. But this sort of describes the different TB classifications. You'll document the person's alien number. And then you'll also state whether or not a transfer has been completed in the electronic disease notification database. So all Class A, B immigrants and refugees are put into this database. And then if the receiving jurisdiction needs to be able to access their immigration documents, then you will need to make sure that a transfer has been completed in EDN so that the receiving jurisdiction can view that information. And then there's drop downs to indicate whether they've had a TST or IGRA done, if they've had their US radiology done, if sputa have been collected. and what their treatment status is. Section 4 is for patients who have been diagnosed with latent TB who are not known contacts to a case or Class AB immigrants or refugees. So this would be for somebody who maybe was identified as having TB infection through employee screening or because they were going to school, that type of thing. So you'll just indicate what results are attached for their TB test, their radiology, sputa, and what their treatment status is. And Section 5 is specific to the patient's treatment status, and it allows the referring jurisdiction to record a summary of the treatment that the patient is currently receiving. So not necessarily the whole history of TB treatment and drug changes, but what the person is currently on. If they're on continuation phase of treatment, for example, you would record only isoniazid and rifampin. The rest of the treatment history is going to be attached to medication administration record or DOT log. So this first drop down here, current treatment summary, asks you to indicate if they are on treatment for active or suspect TB, TB infection, or window prophylaxis. And then you'll want to, of course, enter in what drugs the patient is currently on. And in this drop-down list are the options that are also available on the RVCT form. And you'll notice these first 4 drug boxes have the drop-downs. The last 2 drug boxes do allow you to just enter in free text. So if they're on some sort of non-traditional TB medication or regimen, you can enter in additional drugs here. You'll want to enter in the dosage that they're receiving and how they're receiving it. Is it daily DOT? Are you giving twice weekly DOT? Is it self-administered? Or you can choose other, and it will refer the receiving jurisdiction to look at the attached medication administration record. Then you'll indicate the date that they started the drug and the estimated date of treatment completion. You can enter the last date that the DOT was administered on if they were receiving directly observed therapy, and the number of doses that the patient was given for travel, if any. You can indicate if the prescription was given, and if there's been any side effects or adherence problems. If there have been, you can document that in the notes section here at the bottom, or you can attach patient notes. And this is just a drop down reminding the person to attach the medication administration record or the DOT log. And that is the IJN transfer form. Now I will quickly go over the follow-up form. So this is just a one-page form, and the IJN follow-up form is what the receiving jurisdiction uses to communicate any follow-up that has occurred back to the referring jurisdiction. And when sending the follow-up form, you're going to indicate if this is a 7-day follow-up, 30-day follow-up, final, or you can choose other and then use this open text box to write to describe. You can put in the date the follow-up form was sent and describe what you're following up on. Was this an active case, a contact, etc.? You will identify who you're returning the follow-up form to and who is completing the follow-up form. For the referred person's information, it's important in helping to link the follow-up form with the original transfer form. So the referred person's information should match what was on the original transfer form so that that is easy to do. The follow-up information section allows the receiving jurisdiction to indicate where the patient is in the evaluation process. So you'll record here if the evaluation has been initiated, completed, not done. Maybe they were referred to, say, a private provider, or not applicable. And then you'll also document the evaluation outcome, whether TB disease or infection were diagnosed, whether the outcome is still pending, unknown. And then also what's going on with their treatment. Are they continuing their treatment? Did you start it? Did you stop it? Did you refer them? If the person has active TB disease, we want to make sure that it is getting counted and doesn't fall through the cracks, and that it's being counted for the appropriate jurisdiction. So here you can state who the counting jurisdiction is. And I should say in all of these drop downs, there will be all the different states as well as the big city TB programs and the territories. And then you'll attach any applicable results, diagnostic results. And then the last section here has to do with disposition. So if all the follow-up on the patient has been completed, then you can go ahead and disposition the patient. Just put in the date of disposition, the reason they were dispositioned, because they completed treatment, or maybe you never found them, or the patient refused. If the reason the person is being dispositioned is because they moved, then you'll want to fill out this section here, indicate whether or not you notified the new jurisdiction that they've moved to and what the patient's new address is. And then we have a small note section here. And this concludes the introduction to the interjurisdictional TB notification transfer and follow-up forms. The forms and instructions, like I said before, are housed on the NTCA NTNC's website. And if you have any questions, you can go to that website, and there is an email address there that you may submit questions and comments. Thanks so much.